Okay, this right here is a little hammer toe procedure. I do these all the time. Katie, if you get a little lap sponge for me. So what we're trying to do here is this fourth toe, the patient has a little bit of what we call osteoarthritis. That means it's the wearing and tearing of the joint. Not that it's a big deal. I mean, it's something that I'm getting a little bit of rheumatoid myself. And when you have these, what happens is, as we mature in age, what happens to the body is we typically develop a little bit of bone spurring. She's got some bone spurring in several digits of her foot. Notice she's got a tourniquet on, so she's not bleeding at all. But if we go in here, we'll look, and we've got a small little bone spur in here. I'll either use a little, kind of like a little dental burr blade, and actually open it up, and I'll remove the spur. I can already feel it right now. Patient blade. She's just under straight local. I gave her a little injection of 1% lidocaine plain without epinephrine into the toe. Put on a little tourniquet, put on a sterile drape, and other than a little bit of tourniquet pain, not really anything. It's not very painful. What's good about this procedure is typically she can walk out of here with no pain, and for this she won't feel any pain at all while I'm doing the procedure. But I can already feel she has a pretty hefty little bone spur in here, and it's pretty simple. I just take my little rondure it out and do a little what we call hammer toe arthroplasty. But I can tell the curvature of the bone is really giving her some problems, which unfortunately as we mature in age, that's what happens. But I do a fair amount of hammer toe. I can pretty much guarantee the patient here won't have any pain during the procedure at all, especially when I'm using the little dental burr that I have to burr this out. And pretty much when I'm done, she can pretty much walk out of here without the spur. But see this right here? You take a look right in here. That is the spur. That's the proximal interphalangeal joint. I don't know if you can see that, but it's kind of, you can focus in, Brianna, if you want to. What I'll do, I'll take a little.
When we wish our memory was a little sharper, our concentration more focused, and
It's just this is called a Stryker TPS bone saw. It's probably the most common saw used in healthcare today. I like it because it's you can sterilize it and you can pretty much make it go any way you want. But it's a small little TPS. If you can look at this, Brianna, you can kind of see it turning. Katie's about to put it in, so it's in now. So it's in safe mode now. It's in run mode. You just take it. Basically, I'll just take it and burr out the side, and then after that, she's done. I'll close her up and see she's not even bleeding at all. She'll probably bleed a cc, if that, with the tourniquet. Sometimes the tourniquet gets a little bit uncomfortable, but it's not incredibly uncomfortable. What I'll do, I'll use this little.
through August 31st, 2016, for every immunization given, Walgreens will donate 18 cents up to $2 million. Learn more at Walgreens.
The camera can kind of see how this is working, but basically I'm just taking this off. It's a little dental burr, and I'm just taking the side of the bone off, and I promise you'll feel much better with it removed. See, that's it's incredibly safe the way I took it out. And now, right there.
Professional baseball games over $200. At the same time, over 40% of all sports, concert, and theater tickets go unsold. So how come we're all paying so much when so many?
That's a little bone chip right in there.
I'm Adam Canner.
That's the spur itself.
We found a way to huge savings onto you. On scorebig.com, we guarantee you'll save on great sports, concert, and theater tickets. And we're not talking about last-minute nosebleed seats to events you don't want to see, but millions of great seats for the best events. Days, weeks, even...
Basically, I'm taking, this is called a rondure, double latcher rondure. It takes out bone.
For save over 33% below box office price each
Kind of neat.
with no added fees or shipping.
I'm going to take a little more out. I've already taken one little piece out, so she's probably halfway through. I'll probably take a little more aggressive piece out, and then after that, she is literally, I'm 90% done. I'll be sewing her up a little bit. I use absorbable sutures. I like a suture called polydaxone suture. It's an absorbable suture into the subcutaneous tissues and the capsule. I'm going to sew up the little capsule right here, but I think she's going to be really, really happy when this is all said and done. So this is like a little tiny dental burr using here. I really like them for small little minor procedures like I'm doing. See, I get this smooth as glass, this bone spur is no more. So I like it. I like doing what we call MIS or minimally invasive surgeries. I think that's where it's all at. I think she's going to be really happy. Now I'm going in just like this. With a deep stitch, a couple little deep stitch, and then I'll sew up the skin. This right here, she's got the option for a post-op shoe, but as little of dressing and probably as little of bleeding as she's going to have. She probably won't need any of this. So, if you notice the tourniquet time, it's about 14 minutes, so it's hardly at all, hardly any. Yeah, I'm extremely proud of how this one's going to turn out. This is going to be really, really good. I think she's going to be really, really happy. Again, she'll have swelling for a month or so, maybe 2 months, maybe 3 months, and she'll have some pain afterwards, but shouldn't have anything real too big. I'll take the sutures. Typically, I like to take sutures out in 10 to 14 days. Sometimes I've taken them out too soon. I get bit by doing that, but you know, if you go about 10 to 14 days, you're fine. But you know, she'll have this wrap. Another thing that kind of slows this procedure down is the fact that you know, if I had a little surgical tech in here doing the, you know, I have to put in the suture, then I also have to cut the suture and all that. So. These in between the toes, just like that. One in here, one in here. This looks wonderful. Okay, you can put the tourniquet down.